In this video, I'm going to share 3 patient case studies and success stories using non-surgical robotic laser spinal decompression. This is a revolutionary treatment that combines class 4 laser therapy with true spinal decompression. This method is particularly effective for advanced spinal disorders such as disc bulges, disc herniations, spinal stenosis, degenerative arthritis, anterolisthesis, retrolisthesis. What sets non-surgical robotic laser spinal decompression apart is its ability to promote tissue healing and muscle relaxation simultaneously during spinal decompression, offering substantial benefits for patients with chronic spinal conditions. Now, each of these patients completed a care program in my health clinic, experiencing significant improvements in their conditions. The first patient will detail advanced degenerative disc disease, osteoarthritis, and the need for elite performance, something that's often missing when we talk about healthcare. The second will explore sciatica, disc herniations, and something called failed back surgery. A lot of people think back surgery is the end-all be-all. You're going to discover it's not at all. And the third will discuss something a lot of people don't really think applies to robotic laser spinal decompression, but migraine headaches. So please be sure to watch to the end of the video to discover how this innovative treatment has enhanced the lives of these patients. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. I'm the author of 10 books, including my latest, Low Back Pain is Not a Life Sentence. I'm the founder of National Health Day in Canada. I'm very honored to say we've been voted Ottawa's best 15 times. As well, I've had the privilege to work with some of the world's best athletes. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back pain and chronic neck pain. Now, understand when we come to non-surgical robotic laser spinal decompression, there are only 12 of these patented systems worldwide. We have the only one in Ottawa, Ontario, Canada. We're pleased to say we've had people come from all over our nation's capital, as well as the surrounding areas in Ontario, and even those from the South Outaouais region of Western Quebec. Now, before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. Please tell me in the comments that you've subscribed, and I'll personally reply back to you. Now, before I dive into these 3 patient success stories, I first want to emphasize the importance and need for proper patient examination and preparation. In my clinic, it's crucial to ensure that each patient underwent a thorough examination and had both diagnostic digital x-rays on site as well as a full spine nerve scan conducted to determine if they were the right candidate for non-surgical robotic laser spinal decompression. Now, patient number 1 is Dan. Dan is a 56-year-old elite search and rescue specialist. So now we're not talking about the guys who are coming to your home. Dan is a guy who would parachute with a 110-pound backpack on. He would be the guy in the scuba gear going to rescue you. Dan suffered not only obviously some significant low back dysfunction, had at least a half dozen concussions in these rescue attempts. He was suffering, when he first came to my clinic, suffering with 20 years of back pain, numbness coming down both legs. He had seen the medical doctor, he'd seen the chiropractor, he'd had the MRIs, he was on opioids, he had done nerve ablation to try and deaden some of the pain that the nerve fibers were carrying. He'd had injections, and all of them gave temporary relief at best. He'd even tried many other options to deaden the pain. To quote Dan, he said, "I've tried everything to reduce the pain short of surgery, which isn't recommended." And Dan was at the point where he didn't feel like doing anything. And this wasn't just Dan's personal life, but this is one of the key things, is people who are suffering with debilitating chronic low back pain. This is not the guy who feels the occasional ache here or there, or a little sore after a workout. Understand that if I'm being rescued because I skied off a mountain somewhere, or if Dan has to rescue me underwater, or if I'm lost hiking, in the forest or the jungles, I want to make sure the guy who's rescuing me is not going to have his back go out while he's trying to carry me miles back to civilization. Understand that's how important this is we're talking about not just relieving pain, we're talking about getting back to performance so that you can do the things you need to do. When Dan came into the office, it was discovered that he had advanced degenerative disc disease, multiple what we call vertebral subluxations, where the nerve is being obstructed and interfered with. Dan went on our 8-week comprehensive neurospinal restoration program, which includes non-surgical robotic laser spinal decompression. And I'm happy to say within 8 weeks, even though Dan had this for 20 years, 8-week program, his pain was down to 1 out of 10. We tripled his range, what we call ranges of motion. That's your ability to move your spine. We tripled his extension. We doubled his lateral flexion. We doubled his rotation. And for those who are rehab specialists, we decreased his Oswestry Disability Index score by 24%. I know that doesn't mean much to the average person watching, but this is huge in the rehab world. His full spine nerve scan showed significant improvement, which just meant Dan was functioning better overall in all aspects of his life. And on post x-rays, his osteoarthritis, that advanced degenerative disc disease, we saw a 20% increase in the disc height at the L5-S1 level and a 19% increase in the disc height at the L4-5 level. This is huge. There are many doctors who don't even believe that's possible. We have the pre and post x-rays to prove that. Dan is now finally back to enjoying life, and when you say the number of people he's saved, that he he certainly deserves that. He is off all the drugs and he's back to living the life he deserves. Case study number 2 from the thousands of treatments that we've delivered here in my clinic is Patricia. Patricia is a 45-year-old woman who was suffering with debilitating low back pain and sciatica following a head-on motor vehicle accident. She rated her pain as an 8 to a 9 out of 10. She'd been suffering with this for a year and a half. It was severe pain and numbness as well into the right leg, including bowel dysfunction. So this is important to understand. The same nerves that cause that back pain are the same nerves that come down the leg, but they're also the same nerves that go to the bowel and the bladder and the reproductive organs. When you get to the point where you have some type of bowel dysfunction or bladder dysfunction, or certainly when you lose bowel or bladder function, that becomes emergency surgery. So in her case, she did in fact go in for surgery. She tried everything else. She was also suffering from what we call an L5-S1 disc herniation. It affected all aspects of her life. She simply, just even trying to sit or trying to walk. And again, according to Patricia, she had always been full of life, always enjoying life, always active. And to quote her, "Now I don't recognize myself." Now understand what that does, not just from a pain perspective, but what that was doing to Patricia's mental health and even the effect on her other family members as well. And as I said, she had tried everything: the medical doctor, MRIs, chiropractors, Chinese medicine, acupuncturists, physiotherapy, massage therapy, and then finally ended up with the orthopedic surgeon. 9 months into this ordeal, finally gave into what we call an L5-S1 discectomy. So what they do there is they go in and they literally slice off that part of the disc that is from that disc herniation that's putting pressure on that nerve. And guess what? After that surgery, the pain continued to be just as bad. In fact, she was told by her surgeon, that's the way it's going to be for the rest of your life. Now, again, for some of you that might surprise you, what we do know out of the scientific journals themselves is that surgery has a 74.6% failure rate, where 1 in 3 are back in the hospital within 30 days. And what a lot of people are never told, and this is going to be very important for you, is even with what they consider a successful surgery, there's going to be scar tissue formation. So scar tissue formation, that's how the body's going to try to heal that surgery. And the early stages of that is normal, but if that continues to progress, you can then actually scar that nerve once again. So you may have walked away being one of those lucky ones who thought your surgery was successful, and down the road that scar tissue may come back to haunt you if you're not taking any of the steps to deal with that. And the second thing they don't tell you is that surgery can't stop the progression of that degenerative disc disease. So again, you may think you've had successful surgery, and again, that's a small percentage you have. Down the road, that osteoarthritis, that degenerative disc disease, is going to continue to progress. So what happened in Patricia's case? Well, she needed to come in for that comprehensive exam that we do, where we do diagnostic digital x-rays, we do a full spine nerve scan, and it turns out that she didn't just have the L5-S1 disc herniation, she did in fact already have some advanced degenerative disc disease, and in fact she had 4 disc bulges, not just the one herniation. Patricia went on our 8-week program of a non-surgical robotic laser spinal decompression as part of our whole neurospinal restoration program. This is critical because there are a lot of medical doctors out there who don't believe that you can do any form of spinal decompression, let alone our non-surgical robotic laser spinal decompression, after surgery. And that couldn't be further from the truth. That's why Patricia has what we call failed back surgery. This is actually a technical term for this, where people have gone through the surgery and they are no better, and in fact, in a lot of cases, even worse off. So failed back syndrome or failed surgical back syndrome. What happened in Patricia's case, once going through our program? A 30% increase in disc height at the L5-S1 as proven on x-ray. All of the disc bulges and disc herniations actually receded. All of her ranges of motion, her ability to move either doubled or even tripled. And to quote Patricia, it's feeling good. A year and a half of not being able to do anything, and it's now feeling good. Better sleep, better mental health, able to do the things that she really deserves to be doing. Now, our third case study for today is Elena. Elena suffered with migraines, to quote her, forever. Right? And we're not talking, hey, I've got a little mild headache. She would be out for days at a time. She rated these as an 8 out of 10. To quote her, I had very little life. Now, a lot of people think that robotic laser spinal decompression is only for low back pain or for degenerative disc conditions or disc herniations, spinal stenosis, sciatica, things like that. Well, guess what? That's simply not true. All those conditions you can have in the neck as well, just as well as you can have them in the lower back. And researchers out of Syracuse University, medical doctors, actually found this decades ago, that most headaches stem from the nerves in the upper part of the neck. So if you're having all these conditions, whether it's the degenerative disc disease or disc herniations or osteoarthritis or whatever the case may be, or just the vertebral subluxations that are affecting those nerves in the neck, doesn't it make sense if we take that pressure off those nerves in the neck? And if that's a big cause of migraines and other forms of headache, then your headaches are going to be better. So in Elena's case, she came in for our comprehensive examination. She had her nerve scan. We determined where the vertebral subluxations were. She had the advanced degenerative disc disease. We determined where that was on our diagnostic digital x-rays. Severely limited ranges of motion, so her ability to turn the head or move the neck at all. And that becomes important because when you lose that movement, that actually speeds up the degeneration in the spine as well. She underwent also an 8-week comprehensive program of our non-surgical robotic laser spinal decompression. And to quote her, she had one word: her improvement was huge. Her headaches are rare. The nerve scan showed incredible improvement. The x-rays showed improvement. All of her ranges of motion improved. It has changed her life forever. Tylenol is never going to fix migraines. The lack of Tylenol is not a cause for the migraines. You need to get to all of the underlying causes of the problem. Now, these 3 case studies demonstrate how non-surgical robotic laser spinal decompression, combined with our comprehensive neurospinal restoration program, can significantly change the lives of patients with serious spinal issues. They show improvements in reducing pain, enhancing movement, as well as the positive effects on their overall health, helping them return to a more normal life and finally being able to do the things they want to do and they need to do. Now, I hope you found value today in learning all about non-surgical robotic laser spinal decompression, especially with these 3 particular cases that I've chosen out of the thousands of successful treatments that we've given. Now I want to hear from you. What treatment have you done for your spinal condition? What's worked for you? What hasn't worked for you? Will you consider a non-surgical robotic laser spinal decompression as part of our neurospinal restoration program? Please tell me in the comments below. If you found value in this video, please go ahead and link and share it now so more people can discover non-surgical robotic laser spinal decompression, and so they can stop living with the suffering that they're living with right now. Be sure to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. And please watch this next video here where I explain in great detail what non-surgical robotic laser spinal decompression is all about and how it actually works.